What happens if you are advised knee replacement surgery and you want to delay it? Now, this can be studied under three categories. First is health related impacts, second is psychological impact, and third is the social impact. So if you have been advised knee replacement surgery and for some reason you are trying to avoid it, then what will happen? First of all, if you are not undergoing the surgery, this will lead to progressive damage in your joint. Your knee joint will continue to wear down, leading to worsening of your deformity, that is bowing of the leg. Ultimately, this will make you less and less mobile by each passing day. Also, your pain in your knee will go on increasing, you will get intermittent swelling, and you will ultimately lead to less active life in the form of less walking, or sometimes you have to take occasional painkillers to alleviate this pain, and over a period of time you will get painkiller dependent. Also, this will lead to weakening of your muscles around the knee. That means the major muscle that supplies to the knee, which is known as the quadriceps muscle, over a period of time, it will become weak. So, in your knee, three things will happen. The joint damage will go on increasing, your pain and disability will go on increasing, and the muscle strength will go on decreasing. Also, there are other secondary effects, like if you cannot walk, you will gain weight. Your diabetes will get worsened. Hypertension, that is the blood pressure, will increase, and also greater chances of heart diseases. Also, if you are not moving around because of knee pain, osteoporosis can increase. Also, when a patient tries to avoid knee replacement for long, and ultimately after a few years he or she decides to go for knee replacement, then the surgery also becomes more difficult because there is less muscle mass. Your muscle by now must have undergone atrophy. Also, there is severe deformity of the knee. Also, there are soft tissue contractures. So overall, the surgery will also become more complicated. Now, coming to the psychological effects of not undergoing knee replacement surgery. Some people, they end up with chronic pain stresses like depression or anxiety. Also, they become dependent because they need somebody in the family or some sort of domestic help for climbing stairs, for bathing or walking outside. This often leads to reduced self-esteem. Also, in some patients, it can lead to frank depression and helplessness and hopelessness situation. Not to forget the social impact of delaying knee replacement. It leads to restricted social life, like the person may avoid going out for family functions or traveling because of pain and mobility issues. Also, the work gets suffered because if the person is still employed, he may lose the productivity, face early retirement or financial stresses. This can ultimately lead to more financial burdens and also family related issues. And above all, loss of active lifestyle can really lead to depression. By active lifestyle, I mean hobbies like gardening, sports, walking, travel. So overall, I would say if you are trying to delay your knee replacement for no reason, don't do it, because ultimately it will affect your mental as well as physical as well as social well-being. Your quality of life declines over a period of time. You slowly try to adapt to the disability and restrict yourself to your home. You stop going to social functions, and also not to forget the health impacts in the form of obesity, increased blood pressure, poor diabetes control, and osteoporosis. So, I hope this video was useful for you. If you have more questions related knee replacement or life after knee replacement, feel free to contact us. Thank you.